Pól Callaghan. Mr. Callaghan.
I'm acutely aware of the fact that it has been a long 24 hours for very many of us, but I'm not going to promise brevity if I cannot be sure that I can deliver it. To me, it seems that this budget is really about lost opportunities. Lost opportunities in terms of what is being proposed now and in terms of not allowing the public proper involvement in forming and shaping a new budget for the next 4 years, and also lost opportunities over what this Assembly and the Executive has failed to do over the past couple of years in particular. As members will know, I'm a member of the Health Committee, have been since the end of November, and we have looked at the budget in a number of respects. My colleague Tommy Gallagher yesterday read into the record a number of SDLP proposals about how we think this health budget in particular could be better tested and better probed. But I don't think anybody in this chamber should lightly vote for a budget where such serious and grave concerns have been raised about the potential impact of it were to go ahead unamended. I'd like to just share with the House, Mr. Speaker, some quotes from John Compton, the head of the Health and Social Care Board for the North, who is the senior official in the health service here. He told the Health Committee on the 13th of January that, and I quote, "As currently presented, the draft budget means that we will be short of £200 million in cash a number of weeks after it is confirmed." He went on to say, "On the 1st of April, we would need to be able to spend £200 million less cash, and that is what makes this situation so critical." Now, the officials pointed out from the board that 70% of the health department and filtering down, cascading down the health services budget is spent on people, on wages and various other costs. So unless you're going to sack a lot of people on the 1st of April, those costs will still be there. So you have to deal with services or charges. Those were the options that were put on the table. Now, in terms of some of the potential impacts on services, the following potential impacts were outlined to members of the Health Committee. It's been widely reported about the number of jobs which have been said could be lost. We were told that new and better drugs for patients here that would be available in England would not be available, even though they were approved by NICE under clinical excellence guidelines. We were told that there could be rationalisation of community care packages and domiciliary care. We were given an example that someone at the minute who is entitled to 15 hours of domiciliary care a week might have to wait 2 months to get any domiciliary care, and when they would get it, they wouldn't get 15 hours, but they would get 5 hours of domiciliary care. We were told that there could be longer waiting times, that progress that has been made in bringing down waiting times, not just for particular specialist procedures, but across a whole range of various surgical and other medical interventions, would shoot up from talking about 9-week and 13-week targets to up to 52 weeks waiting times for various everyday medical procedures. We were told that there would be a significant impact on voluntary sector funding in health and social care, and we all know from our own experience the vital role, both in terms of cost effectiveness and long-term wise investment, that the voluntary and community sectors play in the health service. And perhaps most stark of all, to me at any rate, was the prospect of unplanned short notice closures of medical facilities. We were given an example of how a hospital ward or an A&E department could close at as little as 1 hour's notice because there wouldn't be the medical staff on hand to provide a safe service if there wasn't proper provision for locum or other emergency staff if the regular staff were sick or otherwise unavailable. So in terms of the potential impact on health and social care here over the next 4 years, I think anybody who is contemplating voting for this budget unamended or even only mildly amended should only do so having given very serious consideration as to the quite frightening potential impacts that have been outlined to us.
Member Gabby.
I certainly shall.
Would the member agree that the most important issue facing the people in the North West at the present time is the anticipation and the waiting regarding the radiotherapy unit? And given the consequences in the briefings that we've had, and the Speaker and all the members from Derry visited the City Hospital last week to see exactly the provision that was there and the facility there for people across Northern Ireland, that we do know now that there's 10% of Derry people who are having to travel there 3 and 4 times a week for 4 or 5 minutes of radiotherapy, the distress involved in it, the travel times involved in it, that it's an absolute disgrace. Would the member not agree that there should be no games played on this issue, this important subject matter? There should be no question marks over this particular issue, and the costs should be inescapable, absolutely inescapable in terms of radiotherapy unit, because what this is going to provide, not just in the city of Derry, in the North West, will be 1,000 people from our area who are presently travelling to Belfast will get that service in Altnagalvan. 350 people from Donegal will get that service in Altnagalvan, and I am appealing and using through you to the Finance Minister to use his influence on executive colleagues. This is an absolute disgrace and a crying shame that we into a capital investment, 50% of it paid by Irish Government, 30% of the revenue paid by Irish Government, that we cannot go ahead with it.
I thank the member for his intervention, and I would wholeheartedly concur with the remarks which he has expressed. I'm on record myself in the House as expressing similar sentiments, and I think a further point is the absolute essential nature of the radiotherapy centre at Altnagalvan, not only to the future treatment and care of people in and from the North West of the country, but also to people across the whole of the north of the island, because where treatment is not available in Altnagalvan, they will have to still travel to Belfast, and we are told that there simply will not be capacity there, so it will affect everybody who will suffer from cancer over the next number of decades in Northern Ireland. And that is a point that I think should be strongly received by everybody in this House. But I will come back to that point towards the end of my remarks, Mr. Speaker, in terms of some issues to do with the North West specifically. In terms of some of the wider issues around the budget, we've heard on a number of occasions during the course of today's debate as to whether or not the SDLP has provided various figures, or whether or not the SDLP has provided any ideas. If I hear that, unfortunately, Mr. O'Dowd isn't here at present, but if I hear that again, I can only threaten to read into the record the April 2009 New Priorities document, or our economic. Our Partnership and Economic Recovery document, which are both publicly available. And I was disappointed but not entirely surprised to hear that some members hadn't read it, because I think all of us should take an interest in ideas about such an important issue as the future of our economy and our budget, as put out there by other parties over the next number of years. And when I said at the start of my remarks that this was about lost opportunities, we have lost, to some degree, 2 years by trundling along with a substandard budget which was no longer fit for purpose, that was designed in a time when economic prospects, both in the north and around these islands, Europe and globally, were very different to what we have experienced since the recession bit families and businesses very, very hard. Various SDLP speakers have mentioned different things from both of those papers, particularly the earlier one, given that it has been in circulation for such a long time, that have not been pursued. And I need hardly rehearse them, but there still seem to be, there are some things that haven't been mentioned in the debate which I think are worth mentioning. Why do we have junior ministers that are costing taxpayers money but seem to deliver very little in terms of outcomes? Why do we need such a bloated executive information service? Why have we not imposed a pay cut on senior civil servants of 5%, like the SDLP has suggested, or a comparable figure to that? Why do senior civil servants benefit from free car parking in Belfast, when it runs not only against good economic principles, but also good environmental principles, when we're supposed to be trying to get people out of cars and into public transports and onto bikes and other more sustainable means. There are a whole raft of different ideas that we've put out there which could be taken on board. Why do we still own car parks which are actually quite prized assets? I take on board that there is obviously some impact on disposing of capital, of some capital assets in a depressed property market. But where you have ongoing business concerns that are in public hands with a practically guaranteed revenue stream, investors at present are actually seeking out that type of investment, and now would be a good time to release receipts from those to put into other projects and programmes where we are stuck for cash. Mr. Speaker, a major entity in the City of Belfast is the Odyssey. I'm sure every member of the House, even some of the less trendy ones, are at least aware of its existence. It's been there for quite some time now. And when we talk about really probing and testing this budget and every potential source of revenue, I'd like to refer to the Odyssey Trust Company Limited accounts from 2009. Now this, as I understand it, is a charity which exists to serve the public interest. It was set up with the transfer of significant value in public land holdings, certainly into millions and possibly double-digit millions of pounds at the time. But in many ways, it seems to have been left to just deal with its own affairs since the transfer of those assets. Now, in 2009, it spent over £500,000 on 12 members of staff. Now, we could average that out, but what's really interesting